Hi, I'm Dr. John Martin. There's a lot of questions that I've been getting about early pregnancy, so I think I'm going to break this up into a two-part video, so this is the first part. Doctor. I'd like to start with due dates. Due dates are very simply determined by OB/GYN's office, something called Nagel's Rule. And what it is you count back 3 months from the first day of your last period and add 7 days. That is how we come up with a due date. And you are pregnant for 40 weeks from that time. So that's why when you ask your physician, oftentimes they won't speak of how many months pregnant you are, because we don't think of pregnancy in terms of months, we think of it in terms of weeks. And women would say to me, you are counting the 2 weeks that I wasn't even pregnant, because we're going from the period, and typically ovulation and conception occurs within 12 to 15 days after the first day of last period. But not every woman knows when she conceives. I know some of you do, but there is a margin of error there that anywhere from 2 to 3 days an egg can be fertilized by a sperm. So we use the period, which if you're keeping track of that, hopefully it gives us a good number. So we determine due date based off of the 40 weeks from the first day of your last period. Now, why are due dates important? For me, I always tell patients it means that it gives us an endpoint. Less than 1% of babies are born on the due date. But if you have not gone into labor by that time, we start having discussions with you, and every doctor has their own little personal philosophy of when to induce you, but at least that's when the discussions begin if we've reached the due date and we have not had a baby yet. The other thing that I think that is important is due dates are really important when we're watching the growth of your baby, but I think there's confusion because every time you get an ultrasound, you'll oftentimes hear a different due date, and that's because due dates on ultrasound are based off the measurement of the baby, and the bigger a baby is, the greater the margin of error. So that does cause confusion. So I try to simplify it. The very earliest ultrasound is the best way of determining the due date, especially if they're under 10 weeks. What I mean by that is, let's say you have an ultrasound that's very close to your due date by your period, that's less than 10 weeks, then we just use that due date by your period as your due date. Let's say it's very different, it's 10 days off, then we would use the due date by the ultrasound. And the earliest ultrasounds are the most accurate. So that's what most of us physicians will use to determine your due date. So don't be confused and think we're changing it later when you get a 30-week ultrasound that gives you a different due date. And as I said before, due dates are just a rough estimate of when you'll have your baby. The other thing is, if you ever ask how many months pregnant you are, again, we look very confused. So what I would say there is the simplest way to do that is count back from your due date. Let's say your due date is August 1st, so you're 9 months pregnant August 1st. So July 1st, you're 8 months, June 1st, you're 7 months. So that's kind of how you do the months. The other way to do weeks very simply is, let's say your due date is on a Saturday. Then every week on Saturdays, that's when you change your weeks. If you're 28 weeks on Saturday, the following Saturday, you'll be 29 weeks. So that's really a simple way to do it. I've gotten questions on diet, on exercise, on sexual activity. So I'm gonna address that in the next video. I will say it aside, oftentimes I'm asked questions of that I look kind of tired on these videos. Well, I'm still a practicing physician, so sometimes the only time I get to collect my thoughts and record these videos is late at night, so I apologize for that, but just shows that I'm still actively engaged in caring for women, and I take great responsibility for that. Hopefully you do find these videos helpful. If you do, share them, follow me on Instagram and on Facebook. Thank you very much. Have a great day, be safe, be kind, and be well. Thank you. Doctor, you gotta help